people. Our second segment, ladies and gentlemen, of the day is about the fight against the COVID-19. Of course, you know that the second phase of the pandemic is here. In Pakistan also, we see an increase in the number of cases per day, and we've had the NCOC that has been given warnings to citizens time and time again that they need to be extremely careful as far as the SOPs is concerned. In all the scenario, there are vaccines that have come out. Now, in the United Kingdom, which is the first country to have tested its vaccine on its citizens, is with the vaccine developed by Pfizer. Of course, it has to stay under minus 70 degrees centigrade, but nevertheless, it is a huge beginning against this pandemic. To talk more about that, we've been joined by Dr. Anita Raja, who's a general practitioner from the United Kingdom. Anita, thank you very much to have joined us. All right, Anita, as far as this whole issue is concerned, of course, we know that COVID-19 is a pandemic that many countries are working against in the West, in the East, in Pakistan as well. But the United Kingdom was the first country, of course, to have tested the vaccine that came out, that is developed by Pfizer. And of course, a 90-year-old woman was tested with the first dose of the vaccine. It is very important and pertinent to note that, of course, a lot of people who were reeling under the pressure of either being impacted directly by the COVID-19 or indirectly through the economic burdens that have come around associated with the pandemic, are finally heaving a sigh of relief, because slowly and steadily all the people in the United Kingdom and in the long run people across the world will be getting this vaccine. But of course, as per the reports that are emanating from different quarters, it is also being said that the first people who will be getting these vaccines are the elderly, are the people who are at the first line of contact. Of course, we'll be talking to Dr. Anita Raja more on this. Anita, can you hear us?
I can hear you. Can you hear me, Umar?
Yes, of course. Perfect, Anita. So, Anita, United Kingdom is the first country that gets to test the vaccine. Congratulations, first of all. And secondly, how optimistic are you for the future of dealing with this pandemic?
I'll be very honest to you, Umar. This is a very big milestone that we've achieved. The first person in the United Kingdom has been vaccinated today. It's an elderly lady called Maggie. The efficacy of the vaccine is 95%. As you've already mentioned, there is an issue with the cold chain. Of course, it needs to be, kept in minus 70 degrees Celsius, and that is perhaps going to be the next biggest hurdle that we're going to face in terms of administering the vaccine and the transportation of the vaccine. But I'm very, very hopeful, and I'm really hoping that this is going to be a big step forwards, because 2020 has sadly been a write-off in our lives just as yet. But I think this is going to be good for us.
Now, Anita, after Margaret Keenan, what will be the percentage of people and what will be the strata of citizens who will be getting this vaccine in the days to come?
Okay, so now the way they have designed this in the United Kingdom is that the vulnerable group, which is people above 65s, are definitely going to be prioritized. And also they're saying that the first batch will be 800,000 vaccines that are going to be given out. But of course, as I've mentioned before, the transportation and also, the administration of the vaccine is going to be the biggest challenge now. The first set is set to be given in hospitals, but hopefully it will be rolled out into primary care as well, where GPs and pharmacists can actually overlook the administration of the vaccine.
When will, Anita, you be getting that vaccine in the chain of people who will be vaccinated against the pandemic? Because you
hopefully
are, of course,
soon.
a general practitioner. You are those people who are on the first line of duty, who deal with the patients that are suffering from the effects of the COVID-19.
No, I totally agree, Omar. We've lost so many of our colleagues. It has been a very difficult couple of months. I will be honest with you, and it has been very challenging to keep our morals up. But we've been plodding through because we really had no option. This was what we signed up for, and we had to do this. Hopefully soon, but I think the priority at the moment is people who are above 65, people in nursing homes, people with a low immunity.
All right, Anita, there are different reports emanating from the medical quarters and, of course, the different researches that are coming out. That COVID-19 is not really relegated to a certain age bracket. I mean, even infants, even 7-month-olds get COVID-19. And B, that the people are also talking of the virus mutating. How true are all these rumors that are emanating?
Well, you're absolutely right that anyone can get COVID-19, unfortunately, and it doesn't really choose a person depending on their age. But we have seen that there's been a trend where the elderly have been the ones who have been affected the most. Children somehow get a couple of symptoms and seem to bounce back pretty quickly. Whereas if you look at elderly people, they have been the ones, or people with comorbidities, having a low immune system, people who are diabetic, people who are on immunosuppressants, have been people who have suffered the most and have been acutely unwell with this. So yeah, we have to bear that in mind. And as far as the mutation is concerned, yes, you're absolutely right, and there is a concern about that as well. As you know, a virus can mutate itself, and of course the vaccine is the first step, but I don't think that we're there yet. I don't think we have conquered it all, as they say.
Now, when we speak of conquering it all, there is also conquering that segment of the society across the world, whether it be in the United Kingdom, in the United States, in Pakistan as well, who don't believe in the existence of the virus. A, who say that the virus is a hoax. B, who do not follow the SOPs. How to convince these people?
It's a very, very sad state of affairs, Omar. We've seen this very, very closely. As you know, my husband is a hospital doctor, and he was deployed to ITU for COVID-19 when the COVID-19 struck us, and we were having this peak of ours. And it's very sad to see that people are still in denial. It is very much there. We're losing our loved ones, and it's very close to home now. I don't know anyone who doesn't have a relative or a friend who's not had it. So it's very important for us to keep that message alive. You cannot say that it's not there. It is very much there. It's lethal. We have to follow the rules. We have to hand wash. We have to use a sanitizer. We have to maintain that. Not if you can't do a 2-meter distance, at least that 1-meter distance. We have to instill this in our children if we want to live for our children. We have to think about the future. It is very unfortunate when you hear all this, because Omar, I really do. I can't emphasize enough how important it is for us to not forget that it's there and it's very close to home, and there are people who have lost their lives to it.
All right. Thank you very much, Dr. Anita Raja, to have joined us all the way from the United Kingdom. I wish you and your husband and all those who are working in your field all the very best. And of course, congratulations again for being the first country to have tested the new vaccine amongst the citizens of your nation. We hope and we pray that all the citizens across the world get that vaccine in the days and the weeks to come. Thank you very much, Dr. Anita Raja.